All right. Thank you so much, everyone, for coming. We really appreciate seeing everybody joining us today. Um, we are going to get started now. I just wanted to welcome you all to the Patients for Patient Safety Canada webinar entitled Safe from the Start, Safe Care for Every Child in honor of World Patient Safety Day. We're thrilled you could join us either by watching live now or for those of you watching the recording afterwards. I did want to start out by saying we are going to be discussing sensitive topics of children's safety in the healthcare system and child loss. So these can be very distressing topics and potentially triggering for some. So it's important that this be a supportive and a safer space. So I encourage you to do whatever you need to do to take care of yourself during this webinar and afterwards, whether that's deep breathing, getting up and making yourself a cup of tea, moving around in your space, or whatever you need to do for your own mental health and psychological safety. While we love seeing your faces, we also understand that some may prefer to keep cameras off, and that is absolutely fine, whatever your comfort level. Now, as you're listening to the speakers, we encourage you to put your questions in the chat, and we're going to have a Q&A session after all four speakers have spoken. So you're not going to be able to unmute your mics given the number of participants we were thinking of today. So it's really important to utilize the chat. So my colleague Kathy will be monitoring the chat and pulling any questions out for us, and we hope to get a chance to address most of them. And please note that this webinar will be recorded and posted on our Patients for Patient Safety Canada website, patientsforpatientsafety.ca. So with that, if we could move to the first slide. As we gather here together in this virtual space, I just want to take a moment to recognize the history, strengths, and diversity of the many First Nations, Inuit, and Métis communities across Turtle Island. We acknowledge the inherent and treaty rights of all First Nations, Inuit, and Métis peoples across this land, from coast to coast to coast, and we recognize their stewardship of this land since time immemorial. Now, I know that people are participating here from across this beautiful country, so I encourage you to take a moment to reflect upon the land on which you reside. Feel free to post your name and territory acknowledgement in the chat if you so wish. Now, I personally have the privilege to live, work, and play on the traditional and unceded territory of the Algonquin Anishinaabe, Haudenosaunee, Mohawk, and St. Lawrence Iroquois nations, just south of what is now colonially known as Ottawa. As a white person whose ancestors came here by choice during a period of significant and harmful colonization, I recognize that I have unearned privilege based upon the color of my skin and the circumstances of my birth. I want to take a moment to acknowledge the harms that have been perpetuated in the past and that continue to be experienced today by many peoples, including Indigenous, Black, 2S LGBTQ+, and racialized communities. We particularly reflect on the harms experienced within the healthcare system and the inequities that abound. Now, in the spirit of reconciliation and in recognition of this webinar, I wanted to make a personal donation to an Indigenous charitable organization. That's something I like to do whenever I give a land acknowledgement. And so when I was reflecting on where to direct my donation, I started thinking about what this time of year means to my family, and in many families across this country. So it's the start of a new school year, and I am very pleased to be able to have a safe, secure, and welcoming place to send my child back to school. But this has not been the case for many Indigenous children throughout our troubled history. And we want to acknowledge the harms committed in and by the residential school system and the systems in power that created, supported, and enforced it. So in light of the back to school season, I've chosen to support an organization called Legacy of Hope Foundation, which is a national Indigenous-led charity with the goal of educating and raising awareness about the history and many legacies of the residential school system. These include direct and ongoing impacts on First Nations, Inuit, and Métis survivors, their communities, and their descendants. Thank you for giving me a few minutes to acknowledge the land on which we stand. I feel that this is an important act we can take when we gather together, even though I know it only scratches the surface of the responsibility I have as an invited guest and settler on this land. I encourage you all to think about the meaningful steps you can take to further reconciliation within your own life. So, my name is Angie Hamson. My pronouns are she and her. I am a parent and caregiver of a child with a complex medical history, a Patients for Patient Safety Canada member, and I'm a family engagement specialist at the Knowledge Institute on Child and Youth Mental Health and Addictions. I'm here to be your moderator today and introduce the speakers and facilitate the Q&A session at the end. If we could move to the next slide, please. We're just going to talk a little bit about the objectives for today. We know that we have many people registered today, some of whom are here in person, some of whom will be watching the recording. Many people have lived and living experiences. And we also have many professionals who work in healthcare, either delivering care themselves, leading, or supporting that work within the system. So we're hoping that families will gain practical tools and insights to effectively advocate for their children's care. And we're hoping that providers will have the chance to hear directly from families and experts about what matters the most in pediatric safety in healthcare and how to better support children, youth, families, and caregivers. So without further ado, let's welcome our first speaker. So I'd like to I have the pleasure of introducing Marjolaine Provost from Children's Healthcare Canada. Marjolaine is an authentic and dynamic, fully bilingual strategic communications expert, accomplished in traditional and digital media, with over 15 years of experience in storytelling and relationship building. She has a proven ability to combine political acumen with writing skills to create strong brands and craft relevant and clear messages. She's been leading and supporting stakeholder engagement, reputation management, relationship building, and communication projects and outreach at the highest levels of decision making, including in Liberal Cabinet Ministers' offices and most recently as Director of Public Affairs at Children's Healthcare Canada. Marjolaine has been involved with the Liberal Party for years, working in the war room during the 2021 election, and previously volunteering on other campaigns. Marjolaine earned a bachelor's degree in political science and Canadian studies from McGill University, as well as a master's degree in public affairs and lobbying from the l'Institut de Sciences Politiques Bordeaux in France. Marjolaine, I hand it over to you.
Thank you so much, and sorry for those tricky French names to pronounce there. It's my pleasure to be here today representing Children's Healthcare Canada. I will follow your good example, Angie, and I would like to mention that I'm based in Ottawa, so is our organization, and Ottawa is built on unceded Anishinaabe Algonquin territory, and we recognize that the Anishinaabe Algonquin Nation have lived on this territory, cared for this land, and cared for our people, despite the history, for millennia. And as an organization, excuse me, we strive to find balance between our organizational objectives and pursuing what we believe is the obviously just cause of reconciliation of peoples in Canada. Having said that, we can now jump in. So next slide, please. So for those of you who don't know Children's Healthcare Canada, we are actually, the organization's older than me. It's a 55-year-old organization that has evolved through many names. Some of you might know its former name, CAFC, and we are a member organization with members spanning coast to coast to coast, as we like to say, including children's hospitals. So for those of you, for example, in Ottawa, CHEO, in Toronto, Sick Kids, in Vancouver, BC Children's. So big community hospitals all the way to community, regional, and rehab hospitals that have pediatric service units, health regions and authorities, children's treatment centers, home care provider agencies, basically any other organization that is focused on addressing healthcare, delivering and addressing healthcare concerns for children and youth and their families. Next slide, please. This is a great slide, which I particularly love. It was produced by obviously an artist that is very talented for one of our annual conferences. And what I love about this is that it just shows, it tells you what is our goal? Our goal is the development of connected, innovative, and safe health systems for kids. And for the purposes of this presentation, obviously, we are focusing on the safe part of the system. And I'm not going to read everything that's on this slide, obviously, but just to highlight, you see a lot of kids, you see a lot of families, you see practitioners, you see things about compassion and empathy and access. And those are all things that we strive to highlight and pursue in our day-to-day work. We believe that, the system needs to better address children, youth, and families in a safe way, because as we will be discussing today, there are still instances where suffering occurs in healthcare settings. So that's just it's just a really lovely way to kind of summarize everything that we look to do. We can move to the next slide, please. So, in more formal and business-oriented terms, Children's Healthcare Canada, we share evidence and accelerate implementation of high-quality youth and family-centered healthcare. We convene all kinds of partners to further these goals, and we advocate, mainly at the federal level, I would say, to improve children's health and health systems. And forward, thank you. So, getting into the heart of the matter today, we were asked to provide kind of an overview of what is going on with children at large in the health sphere in Canada. And unfortunately, the one-liner that you'll see at the top there, the kids are not okay. That was actually the title of a Toronto Star series of articles last year. So unfortunately, I mean, most people on the street would say, sure, the kids are fine. Although today we are seeing more and more talk about, the impact of screens and digital involvement and activity on our youth. But to give you a few statistics, which are unfortunately all pretty sad, 4 in 10 pediatric surgeries are occurring beyond clinically safe timeframes. The correlation to that is that a lot of kids actually today wait longer than adults for comparable services, which is obviously unacceptable. Children's hospitals functioning over and above 100% capacity is now common. It's not an exception anymore. We have all heard stories of people who are endless waiting lists for essential care like diagnostics, mental health, or developmental assessments. And unfortunately, if you have the bad luck of turning 18 while you're on that list, well, then you fall into what we call the transition gap. And then you and your family have to start all over again, probably adding painful waiting time to, an already too long wait. We can point to a lack of national pediatric quality and safety standards, although one hopeful moment was the launch of the pediatric pain standard a couple of years ago. So that was obviously a welcome development. And then the last point here is that we don't have proper data. So we know, we know anecdotally and from different pockets that these things are occurring, but there is no consistent data collection and reporting mechanism specific to children's health outcomes, which obviously makes it difficult to detect and respond to safety concerns at a system level. Next slide. So why do we think the pediatric safety is a systems challenge? Because if we don't address this issue, the consequences are dire and profound. We could see increased medical errors, delayed diagnoses and treatments, preventable hospitalizations, or hospitalizations that go on for much longer than needed, with all of the troubles that can bring. And last but not least, worsening, health inequities amongst marginalized and underserved populations because of unfounded beliefs, racism in medical practices, and a whole host of other kind of historical context that unfortunately still has consequences today. So this is much more hopeful. This is a report that we launched last year, which was called Beyond Bandaids, Delivering Healthcare Fit for Kids. And the reason why I want to bring this up is because this was kind of a landmark consultation exercise that our organization did over about a year and a half. We had more than 600 touch points with various experts, family partners, patients, politicians all over the country. And the idea behind this report was to try to figure out, how do we move forward from here? So, it's one thing to say the system is broken, we need to fix it, we need better services for children, but in actuality, practically speaking, how do we do that? So what I did want to highlight from this report are what we termed the 3 building blocks. So we determined through all of these consultations that without these 3 building blocks, we would not get anywhere in terms of improving overall the health system and specifically addressing safety issues for kids. So the 3 building blocks are dedicated, and this will be no surprise, dedicated and protected funding. There are no permanent funding mechanisms specifically for children's healthcare. So that in itself is a huge issue. And we obviously need this funding to be to target the whole continuum of care, not just hospitals, for example, including research, because we do need research and evidence to inform good policy and decision making. Second point is the data. As we've outlined previously, we need data, kind of standardized data collection methods. We need to determine what it is that we're collecting data on and how do we report it in a way that is usable, as in apples to apples. And then a highly specialized workforce, of course, to care for children and youth. That is another issue. We don't really know how many specialists we have in Canada that care for youth because, and once again, not everybody reports the same way. Some people count pediatric specialists one way, and in other places they're counted another way. So again, this is another barrier that we're looking to address. And once we have all these building blocks, we wholeheartedly believe that we need a national strategy for children and youth health and well-being, along with an accountability person, which we've been calling for a chief children's health officer, whose job would be to basically drive that strategy and make sure that we are making progress towards more safety and better care for children in Canada. Next. Thank you. And as such, as part of this exercise, we also did a little bit of polling, which I thought would be interesting to share today. Again, I don't think you'll be surprised by any of this content. So through our polling, done through Abacus polling last year, we found that 4 in 10 parents are not confident that they can access timely healthcare for their children. That sounds pretty true based on waiting lists and anecdotes that we hear. 88% of Canadians support earmarking a portion of the Canada Health Transfer specifically for child and youth healthcare. Those of you who are well versed in jurisdictional battles will know that the provinces don't like it when we say you must use this money for X, but it is a lever that the federal government has in its hands, and we highly encourage them to use it. Lastly, 92% of Canadians, and specifically 94% of parents, agree that investing in, generally speaking, physical and mental health services for kids will contribute to a better future for the country. It is not rocket science. Invest in children, get better returns for your country, and, healthy population, better productivity, better workforce. It all kind of makes sense, but the proof is in the pudding, as they say. So we are working hard to drive that message home to different levels of government. I'm going to keep going. Thank you. So getting back a little more specifically to patient safety, how do we get to improve patient safety specifically for kids? We need patient-specific safety metrics and reporting mechanisms implemented in all basically institutions and learning health systems principles so that we can, of course, learn from things that are happening in real time and implement best practices. Back to what we were saying, it's always about the money. We need more investments in pediatric health human resources and infrastructure and digital tools because we do live in the 21st century. And we need to prioritize national coordination. That is one thing that was another big highlight coming out of that Beyond Bandaids report, is that no entity will solve this issue alone. We need coordination at the federal level. We need coordination between federal and provincial levels, even from institutions with the provinces. So, it really is a team effort when it comes to improving kids' health and safety. So what are we doing specifically to kind of further this along? We're trying our best to raise awareness, such as participating in today's webinar. So thank you again for the invite. Raising awareness to catalyze action regarding emerging and enduring priorities, so long-term and more short-term as things kind of happen, in real life. We do try to broker subject matter expertise to inform public policy. So that means putting experts in front of decision makers as much as possible to make sure that the policy decisions are evidence informed. And again, it's all about the policy. We do some policy work, developing recommendations to address, again, emerging and ongoing issues. And now on the next slide, what can families do? Because we know that is something that we wanted to cover in today's webinar. So doing what you're doing today is actually a really great first step. Engaging in planning, feedback, systems designs, I would say in consultations, learning opportunities, that's a great first step. If you want to go further and make your voice go a little bit louder, I'll say, you can contact your elected officials to encourage them to get involved in these issues, to care about children, to think about what is the impact of this decision on children's health and their health systems. You can write, again, if you're willing to lend your voice to the cause publicly, you can write opinion letters or share your story, either on your own media platform, social media, or send it to a local media outlet, in the form of an open letter, for example. And last but not least, I would say you can get engaged with a local advocacy group in your region or a national organization such as this one. So I think there are many ways that families can advocate. I guess another point that is not on here would be to reach out to whatever institution you are, whose services you're using, and ask, do they have any channels where they would like, patient stories to be shared? Or do they need patient or family voices to further, an advocacy message? So that's another way that is accessible if you so choose. Next slide. And of course, I'd be remiss if I did not invite you all to join us in Calgary next spring. We are having our annual conference. Oops. Too fast. We are having our annual conference from May 31st to June 2nd. The theme is Tomorrow's Promise, Today's Plan. How do we transform children's healthcare in Canada? It's going to be a great conference, and I hope to see some of you there. And thank you very much for the opportunity to share with you today. And I will look forward to your questions at the end of the webinar.
Thank you so much, Marjolaine. I really appreciate that. And I love what you said about how people can advocate themselves. That's really informative. We now welcome Dr. Joss Reimer from the Canadian Medical Association to the stage. Dr. Reimer is a past president of the Canadian Medical Association and chief medical officer for the Winnipeg Regional Health Authority. She is an expert in public health, health communications, health equity, and immunizations. She was also the medical lead and spokesperson for Manitoba's COVID-19 vaccine task force and spent 9 years as the director of population health at the University of Manitoba. Dr. Reimer practices maternity care and has received awards such as Humanitarian of the Year by Doctors Manitoba and holds the King Charles III Coronation and Queen Elizabeth II Platinum Jubilee medals. She completed her medical training at the University of Manitoba and McMaster University and holds a master's in public health focused on health communication. Dr. Reimer, thank you so much for being here today.
Thank you so much for the opportunity. It's really wonderful to be here on behalf of the Canadian Medical Association. Let's go to the first slide. Next slide. I really appreciated the territorial acknowledgement and the way that it was focused, not just on saying the words, but really applying it to the situation. Because one of the areas that often doesn't get talked about enough when it comes to patient safety is cultural safety. And so hearing the territorial acknowledgements is really just the beginning of what we need to be doing when it comes to this area. But really, while this isn't the main area of my talk today, I think it's really critical to at least flag how important this is that we strive to address the inherent power imbalances, the ongoing racism and discrimination that happen in our healthcare system and that are causing harm to people, both historically but ongoing as well. So thank you for that. I also want to flag that psychological safety is an important one. It's so easy for us to focus on physical safety, which is also really important. And you're going to hear some heartbreaking stories today where physical safety was not protected. But the psychological safety, making sure that our care environments are a climate of trust and respect, is also really important. But today on the next slide, I'm going to focus on a different side of things, which is misinformation. And that's not typically what we think about when we're talking about patient safety, but we know that health misinformation is causing very real harms to Canadians. And so it is something that I want us to think about when we are talking patient safety, because it is one of many ways that people can experience harms in our health systems. And particularly right now with what we're seeing south of the border with the removal of scientific experts at the CDC, the gutting of their health research budget, and that administration's approach to vaccines, this is something that doesn't respect borders and is impacting Canadians as well. It's impacting our mental health, but it is also impacting our physical health. Next slide. And we actually have some data on this as well. Much like the previous speaker, we had Abacus do some surveys for us, and we found a lot of really concerning things when we looked at that. On this slide, some of the biggest concerns to me were first that 37% of Canadians felt they really had no option other than to go online to get their health information because they don't have access to a primary care provider. So that's a big concern. There's 6.5 million Canadians who don't have access to primary care, and that includes a very large proportion of kids. And so going online, whether it's the kids themselves as teenagers or their parents when they're younger, is their source of health information. And the last bullet on this slide also is really concerning to me because it shows me that almost a quarter of Canadians recognize that they've already experienced a negative health impact because they followed false information that they saw online. So that's just the quarter who recognize that that's what happened. That's really concerning to me because there's so many more people who may not even realize that decisions that they made based on misinformation have caused harm. Next slide. There are a lot of examples. I'm sure many of you have seen many of these examples online, and some of them can be minor, but some of them are life or death. When we think about the fact that people are talking about how sunscreen causes cancer, when in fact skin cancer is the #1 cancer in Canada, these impacts don't reveal themselves for decades. But if parents are choosing not to put sunscreen on their kids, that is going to potentially have lifelong impacts for them later on in life. Where there's so much misinformation about vaccines out there, no matter how many times we disprove it, there's always going to be talk about autism and vaccines. We've studied this so much. There's no link, but this will not go away. And we saw during COVID all kinds of other things about sudden death syndrome with the COVID vaccines or turbo cancer, which isn't even a real thing. And here's just a few other examples. Raw milk being touted as safe, seed oils being touted as toxic, telling you need to take supplements when other than vitamin D and sometimes B12, there's really, unless you have a health condition, there are no supplements that are required for all of us. We get almost all of our nutrition from the food we eat. Even sugar and hyperactivity, that those two are not linked, but that continues to be perpetuated. So some of these, believing about sugar and hyperactivity, maybe not life or death, but I want to tell a very quick story from my own practice. I was recently at the hospital. I do labor and delivery care. And so we had someone who had a postpartum hemorrhage, so bleeding right after having had a baby. And she needed to receive blood because she had lost so much blood. So she needed a transfusion. And she chose not to receive that blood because she didn't want to receive vaccinated blood. And this is someone who's just had a baby, trying to make the best decisions for herself and for that baby. And it became a life or death situation for her because of misinformation. And as a physician, as a public health physician, these are heartbreaking to watch because we know that this information is coming at us all, and we're really being bombarded by it, and it's so hard to navigate through. I really know that parents are trying to make the best decisions for their kids. Next slide. In my intro, we mentioned that I led our COVID-19 vaccine task force. So misinformation is something that I have seen over and over again, causing harm. There was somebody from my hometown who chose not to get vaccinated and died from COVID. And despite that, the family still stands by the choice to not get vaccinated because of how strong that misinformation is and the way that it can impact our psyche. But there are some lessons that I've learned, next slide, that I want to pass on to you today because I think that there's some really important things that we need to keep in mind, but I also have some things where we do have some power as well. So it's not all doom and gloom. This comes from my experience at the CMA and as a public health physician. And the first thing is what I mentioned on that slide with the statistics. When we have a situation where there is both misinformation flourishing online and a health system that can't meet people's needs, that is where we're going to see real harm. People who are forced to go online to get their information, who don't have a healthcare provider that they can double check it with, what other option do they have? This is a double whammy we haven't ever seen with any other generation, and so it is leading to more and more people seeking help from problematic sources. And so the CMA is trying to urgently call on all levels of government to change primary care so that we have more team-based care, so that there are physiotherapists, there are counselors, there are social workers who are working together with the physicians to make sure that we can provide more fulsome services to people and expand the number of people we can provide care to as one example of the type of work we want to see. Next slide. And this one, I'm a bit skeptical that it's going to happen, but social media platforms are a big part of the problem. So not only do we know that's where the information flourishes, but the companies themselves are making it worse. They use the algorithms in a way where misinformation is promoted more than true information. This is because misinformation is often flashier. It gets more clicks, more comments. You can make really interesting claims without having to back them up. And so the engagement is easier. And so those algorithms actively, intentionally push that. And if the companies wanted to, they could change the algorithms today so that true information, trusted sources got pushed into our feeds more than the misinformation. But in the absence of that happening, because it seems unlikely, next slide, we also have a lot of power. And here's one of the areas that we don't really think about the impact that we have. But I want you to think about a time where, you were on TikTok, you were on Instagram, something like that, and you happen to look at, a couple cat videos. Not a ton, you're not even that into cats, you just happen to like it, and suddenly your whole feed is just full of cat videos. The algorithm is really responsive to what you look at, to what you click on, to what you comment on, to what you share, and it responds very quickly. And so we actually are really powerful in what we tell back to the algorithm matters to us. So when you see a healthcare provider, when you see true information being shared online, you have a lot of power to like it, to share it, to watch the video, to comment on it, even if your comment is just like a heart emoji. These things all tell the algorithm that this is important information and that the algorithm should share it with even more people. And so I hope that all of us think about that. And even, if you wouldn't normally like things, try to be really intentional about what you give your energy to, what you give your likes to, because that is currency in social media. And so in the same realm, if you do see misinformation or things where you're not sure, don't share it. We know how quickly these things get shared. And so if you are not sure, before you share it, make sure that you've double checked somewhere else, a trusted source, because these things spread like wildfire. And with the dramatic weakening of the policies at Meta and X about fact checking, this unfortunately now falls onto all of us to do this, to make sure that we are not perpetuating the problem. And there's some tools that you can use, things to watch out for. Next slide. Where you can look on Snopes.com. You can go to some of your trusted sources. So the Canadian Pediatric Society, some of the speakers in this webinar, their websites are going to have reliable information. Going and checking an alternate source can be really helpful. But I would also say just watch for red flags when there are really emotional triggers, strong language, all or nothing thinking, stuff that tells you to never do something, always do something. Maybe they're using terms like toxin or hormone balancing, these terms that don't actually mean anything but sound important, sound scary. All of these things can be red flags. And it doesn't mean the information's wrong, but it does mean you should take a step back, double check where the information's coming from. Is this person an expert in what they're talking about? Are they trying to sell you something? And then check with those trusted sources. We want to have everybody in Canada being really savvy about what they read online, what they trust online, and what they share, and how they give that currency of their attention into the algorithm. Next slide, because we know there's going to be another crisis. I don't know when it's going to be. I don't know what it's going to be, but this is going to happen. And with misinformation the way it's spreading right now, the catastrophic impacts for healthcare workers, for patients, this is going to be even greater than what we saw during COVID. And earlier this year, for example, we saw in Alberta, they had a COVID-19 pandemic data review task force, and they issued a report that promoted misinformation, that actively was sowing mistrust in the medical and scientific communities. So we are calling on governments, as well as all of us, to focus on connecting patients to quality care that they need, to uphold science, to uphold evidence-based medicine as the cornerstone of that care, and protect us in the day-to-day and in the face of any future health crises. Next slide. But that really is my call to action then. We can all be information champions. There is great research showing that yes, healthcare providers are a really important source of information to people, but even more important to how people make decisions is what their loved ones tell them. We trust our friends and our family, and we follow their advice more than anyone else's. And so even if you're not an expert in something, helping your friends and family to go to trusted sources, helping them to think critically about the information that they're seeing is going to make a bigger impact than any of us in the healthcare environment can do alone. And so you have a lot of power, both if you're the expert in that area, but also as the person in the life of somebody who's trying to make a health decision. And so I hope that you really take this to heart. Right now, the youth are online more than ever before. This is where they're getting their information. They're getting misinformation, whether they're looking for it or not. And so when we're talking about parents, when we're talking about their friend groups, I am more concerned now than ever about the misinformation environment, but I also know that we can all be drivers for change. And so this is something that rather than just feel hopeless, we all can be part of the solution. We all can help people with the tips that I provided today, going online, how we do things. And finally, I'll just share one resource from the CMA. It's next slide. Healthcare for Real is an online platform that we have. We're on all of those spots you see there. So Instagram, TikTok, YouTube, Threads, Blue Sky. And it's a really wonderful initiative from the CMA where we're sharing information about the health system. So it's not health advice directly, but it helps people understand, why are wait times so long? Why do we have children's ERs versus adult ERs? And how come we have to wait so long when we're in the ER? Or what does it mean to have to go to a specialist and get a consult? It's all of these types of things to help people understand how the system works and debunk common myths about the healthcare system. And so I hope that you can add that to your list of things that you follow along and try to help us to share accurate information as well, because that's really our goal here. So in closing, on the last slide, I will just share a couple of resources that I have already talked about. The full results of our health and media tracking survey, which dives into topics of trust, health, and misinformation. And we do have a new one that'll be coming out for this year very soon. I don't know the date, but keep your eye out for our annual update. And then also the link for Healthcare for Real is on this slide as well. And so with that, I'd like to hand it back to our chair to go to the next speaker.
Thank you so much, Dr. Reimer. That was so informative and really great. I know there's been a couple of questions in the chat that we'll try to get to later. But now I have the pleasure of introducing my colleague with Patients for Patient Safety Canada, Melissa Sheldrick from ISMP Canada. So Melissa is a trained educator and has been working with families for more than 20 years. She began advocating for improved safety after the loss of her 8-year-old son, Andrew, from a community pharmacy medication error in 2016. Since that time, Melissa has been working tirelessly with organizations to advance continuous quality improvement programs in community pharmacy, including error reporting. She's an active member of Patients for Patient Safety Canada and continues to advocate for patient safety, and more specifically, medication safety, across the country and internationally. Melissa has delivered presentations on patient safety to local, provincial, national, and international audiences, and we're thrilled to have her speaking with us here today. Melissa, thank you so much.
Thanks so much, Angie, and thank you to the team for putting together this incredible panel. It's really a privilege to present with all of you. And it's really important for us today as we talk about safety and healthcare for children that we address medications, the risks of medications for our littlest patients. And, children and youth have really unique health and safety needs, and conditions that adults experience can look very different in children. And in addition to that, medications can have different effects on them than on adults. And we have to remember that children are not little adults. Their bodies process medications differently, and even small errors can have serious consequences. Their weight, their body chemistry, their developmental stage, these are all variables in how medications can affect them. Medicine needs to be studied in pediatric populations to ensure they're safe and effective. But these studies are complex, they're challenging, and as a result, many medications that are prescribed for children and youth are prescribed off-label. Off-label means that the use of the medication is different than what Health Canada has approved for market in Canada. So, for example, a prescriber may offer this option if there's research that shows that the benefits of a particular medication for a condition outweighs the risks. One example that we heard at ISMP Canada is that of a blood pressure medication for an infant. The caregiver was unsure of the prescription because they knew it wasn't approved for children, but they engaged in a conversation with their prescriber. They asked questions to better understand the risks and the benefits. And once the caregiver received that information, they were able to make an informed decision. Now, the concept of off-label medication is important for parents and caregivers to consider when making decisions about their kids' prescriptions. For children who contend with chronic conditions, the decisions about appropriate meds should also complement the other strategies that children and parents may have in place. It's really important to look at the whole child when discussing medications. Another risk for children and medications is the lack of commercially manufactured pediatric formulations in Canada. This means that some prepared medications for children are not available here and have to be compounded or specially prepared into different forms that children can manage. For example, a liquid. Compounding is a riskier process than the normal dispensing process. However, for some families, it is the only option. The risk of compounding is very close to my heart. In 2016, I lost my 8-year-old son, Andrew, to errors that were made during the compounding of his medication. He was on a daily dose of tryptophan for a sleep disorder, and the main error made was that the tryptophan was substituted for baclofen, a really powerful muscle relaxant. The liquid compound was made in the same concentration as his tryptophan should have been, but because it was baclofen, it was 3 times the lethal dose for an adult. For a child of his size and weight, it was a 10-fold overdose. Since that time, I've been working in medication and patient safety to prevent these errors from recurring. Next slide, please. When it comes to giving medicine to children, small changes can make a big difference for safety. First, always use the right tool to measure medicine. Kitchen spoons are all different sizes, and we've all been there before. And even being off by a small amount can matter for a child. So ask your pharmacist for a syringe or a dosing cup that's made specifically for medicine to be really specific with the amount that you are giving. Second, double check the label every time. Every time you give it to your child. Many liquid medicines look alike. They come in similar bottles. So reading the label carefully before you give a dose helps to make sure it's the right medicine for the right child. Thirdly, remember that many prescriptions are off-label, meaning the medicine wasn't originally tested or packaged for kids. And that's common in pediatrics, but it also means you should never adjust the doses on your own. If you're unsure, always ask your pharmacist or your prescriber before making changes. And finally, it's important to keep things clean when giving medicine. Wash your hands. Make sure syringes, inhalers, or spacers are clean. If you're giving an injection, make sure you clean the site. A safe environment reduces the risk of infections and helps the medicine works the way it should. Next slide, please. Parachute Canada states that medications are the leading cause of poisoning in children. Every year, many children end up in the emergency department because of accidental poisoning, and most of the time it happens at home. The good news is that a few simple habits can make a big difference. So keep the medicine in its original child-resistant packaging. Child-resistant, not child-proof. These bottles are simply designed to slow kids down. And so moving pills into other containers makes it much easier for a child to get into them. Never call medicine candy. It might feel like a way to make it easier to get a child to take the dose, but it can really backfire. Kids could go looking for candy on their own. Read the label every single time before giving medicine, as I said. It's really easy to forget a dose or mix up instructions, especially if you're tired or distracted, or if there's been a recent change in the medication. Checking the label helps catch mistakes before they happen. And fourth, when you have visitors, make sure their purses or their bags are out of reach. Grandparents, friends, babysitters may have medications in their bags, and we know that kids are curious and they love to explore. And finally, store all those medications up and away. High shelves or locked cabinets are best, even if you think your child can't reach them. We know that kids are resourceful climbers. So just to recall that, keep it in the original packaging. No talk about candy. Read the label. Keep those bags and those medicines out of reach and up and away. And these are simple steps, but they can really prevent a tragedy from occurring. Next slide, please. So on the left, you see a tool about the 5 questions, and this was developed with a team of people from across the country. It was co-designed by safety organizations, patients and families, pediatric health providers, and others as well. And one of the goals of this tool is to get kids comfortable about asking questions about their medications, teaching them as early as 6 or 7 years old that having a conversation about their medications, their health in general, will spark their health literacy and help it to grow over time, so that when they're adults, they can speak up about their care and be part of their own safety journey. We included some safety tips there on those little Post-it notes for them to remember as well. Starting simple, starting young will help empower them with a tool belt of skills. And kids who need medications will be better equipped if they have the information that they need. On the right is an example of a newsletter for parents that we publish at ISMP Canada. Part of the work that we do is to learn from medication errors that are reported to us by the public, and we turn that information into safety tips to prevent future errors. This one happens to be on getting kids ready for camp, but you'll find many others if you follow that QR code. If you do experience a medication error for yourself or with your child's medication, you can report it to us at mederror.ca. The next slide, please. So just to summarize, when we think about keeping kids safe at home, we often focus on things like car seats and bike helmets and baby gates. And one area we sometimes overlook is medication safety, but it is equally as important. And so the first step is simple. Review your home today. Take a walk through your kitchen, through your bathroom, through your closet, any place that you store medicines. Ask yourself, are they stored up and away from children? Are they in their original child-resistant containers? A quick check can prevent an accident. Next, look closely at the medicines your children are already taking. Are the instructions clear? Has the dose changed if they've grown? Do you have the right measuring device? Kids grow quickly, and what was safe last year and effective might not be the right dose today. Have those conversations with your prescriber, your pharmacist. And finally, make asking questions part of the routine. If you're not sure why a medicine is prescribed, how to give it, or what side effects to watch for, ask your doctor or pharmacist. And just as important, start teaching your children to ask questions too in age-appropriate ways. When kids grow up comfortable speaking about their medications, they carry that skill into adolescence and adulthood. So thank you for the opportunity to bring you these medication safety tips for our kids. They are very important and help to keep our kids safe as they grow. Thanks so much.
Thank you so much, Melissa. That was wonderful to hear a little bit about Andrew and to hear a lot of your perspectives and what you shared with us. There are some comments in the chat expressing condolences as well. So I wanted to direct your attention to those. Now I have the pleasure to introduce our final speaker for the afternoon or morning, depending on where you are. Theresa Malloy-Miller is another one of my colleagues from Patients for Patient Safety Canada. Now, Theresa, the tragic and preventable loss of her son, Dan, related to a healthcare harm, has changed the course of Theresa's life. That led to Theresa becoming a founding member of Patients for Patient Safety Canada in 2006. The unimaginable pain, combined with her determination, became a force that shaped changes both in the organization where the harm happened and at the Canadian level. Within Patients for Patient Safety Canada, Theresa has helped shape webinars, completed a 2-year term as Patients for Patient Safety Canada co-chair. She's the chair of the Knowledge Transfer Group and co-leads the Canadian Alliance for Patient Safety with Melissa Sheldrick and Carolyn Hoffman from ISMP Canada. As well, Theresa is a retired pediatric occupational therapist. Theresa, thank you so much.
Thank you, everyone. It is such an honor to present with this very accomplished group of presenters. I've enjoyed this so much. Sometimes things go wrong in healthcare. All Patients for Patient Safety Canada members have experienced healthcare harm either directly or through our family members. The data certainly is concerning, and as our speakers have highlighted today, there is much to do. I will be sharing the patient safety hopes of Patients for Patient Safety Canada members. First is Joshua Nixon. Next slide. His lived experience is shared by his mother, Dale Nixon, who's a Patients for Patient Safety Canada member. At the time of her pregnancy, Dale was expecting twins and had had a previous C-section. She was hospitalized early because there was a risk of premature labor. Both babies were doing really well. The plan of care was a trial of labor, and at the first sign of difficulty, a C-section would be scheduled. Dale still hears those words today. Jeremy was born first, and then Joshua was not delivered until 2 hours later. He had had an extended period of severe fetal distress. He was diagnosed with cerebral palsy and passed away at age 3. Dale says if only their family had truly been the focus of care and there was a culture of safety, perhaps there could have been a different outcome. She wonders, what if the obstetrician on call had reviewed the established plan of care? What if all of the staff knew her past obstetrical history? What if all the team members felt safe, valued, and respected and worked as a team? What if the oncoming obstetrician acted when nurses informed him of Joshua's fetal distress? What if just one team member had informed Dale about what was happening with her baby? Next is Daniel Chang Bard, and his experience is shared by his mother, Eileen Chang, who's a Patients for Patient Safety Canada member. Daniel was diagnosed with myalgic encephalomyelitis at age 19 after 2 years of health challenges and as he was transitioning to adult care. He faced many challenges over the 2 years, assumptions and biases being stereotyped. He and his family felt their input was not being heard. He was very articulate, and his mother is a healthcare provider. It was difficult to find someone who understood ME. Daniel was left with the feeling his condition was not treatable and there was no real diagnosis. Daniel needed to be accepted as part of his healthcare team. He needed healthcare professionals who actively listened to him and engaged with him in understanding what was happening. He needed a healthcare plan that was collaboratively developed with him. He wrote in his journal, "What is worse than this illness is having a doctor that doesn't understand and acknowledge it." Next is Matea Robbins. Next slide. Her lived experience is shared by her mother, Sabina Robin, who's also a Patient Safety Canada member. Matea, an infant, needed a triage, treatment pathway, and healthcare services based on her diagnosis. She needed a system-wide hospital process to ensure that patients received safe care with a standard order set for a bleeding disorder. If that, would Matea's vitals and change in level of consciousness alerted healthcare providers to escalate her care and monitoring, as well as notify the attending physician? Would a rapid response team have been notified? Would the family been included in the possibility of activating a rapid response team? When families are accepted as a member of the healthcare team, this increases confidence rather than distrust in the medical system and actually has the potential to affect greater positive patient outcomes. Matea needed a healthcare system where all healthcare providers receive regular bias training. If so, would Matea's symptoms have pointed to her deterioration rather than further gastro diagnoses, looking at her as a typical infant? Would the escalating concerns of Matea's mothers have been heard and acted on? Next is my son, Dan. Dan looked like he had a really bad case of the flu. Over 2 ER visits, he received multiple diagnoses, and we, as his parents and Dan, felt that our concerns were not being listened to. Dan needed health care based on a system-wide culture of safety. If that, would Dan's abnormal blood test results have been reviewed in a timely manner? Could they have caught his deterioration? Would his high heartbeat have alerted a broader view? Would his low blood pressure been looked at as a sign of deterioration and not as equipment failure? Would the charting x-ray of a normal chest x-ray been caught? His enlarged heart might have been found on such an x-ray. Dan needed all members of the healthcare team to be supported to act with patient safety knowledge, skills, and strategies. If that, would the resident have listened to the cautions of a nurse before administering sedation? So many things. And the last is Braden Robbins, and a very recent lived experience of untreated hydrocephalus and a brain bleed shared by his mother, Nikki Robbins. Central to Braden's tragic outcome was confirmation bias on the part of healthcare providers. Assumptions made based on Braden's disability undermined an urgency of care. There was a failure to provide timely imaging and transfer to pediatric care. There were a number of provincial recommendations following review of his care. I'll just note a few. To establish mandatory family-centered communication protocols to ensure families are heard and included. Implement a unified interprovincial charting system. Assign a family-centered caseworker following the death of a child to support families through the review process. Last slide. For all children to receive safe healthcare in Canada, we need a culture of safety where everyone is respected and aware of what a culture of safety requires. We need effective team partnerships where all members are respected and heard. The patient and family and their lived experience must be respected and be an essential part of the healthcare team. families know their children best. We need active listening, engagement, and clear communication as consistent features of the healthcare team, leading to collaborative care plans. We need patients' and families' views included in constantly improving healthcare safety systems based on reporting and learning, which is integrated into routine healthcare practices. We understand that sometimes things go wrong. When that happens, talk to us and include us. We want to see accountability, transparency, and compassionate support for all who have been impacted so that we can all heal, regain trust in the healthcare system, and strengthen safety. Thank you for listening, and back to Angie. Thank you, everyone. This has been an amazing sharing of information for children. Thank you.
Thank you, Theresa. That was wonderful to be able to share so many personal stories on behalf of some of our Patients for Patient Safety Canada members. As distressing as they were to hear, it's important to be able to learn from these experiences. Unfortunately, we're not going to have time to get into the questions that people have put in the chat, and I really apologize for that. But I'm so glad that we had such great presentations from Marjolaine, Dr. Reimer, from Melissa and Theresa. We really appreciate all of the time that you spent preparing for today, presenting today, and sharing your thoughts and opinions with us. For our guests, please note that we have the QR code here for the Heart of Healthcare gallery. And Janet is going to put up an evaluation poll. If you could take a few minutes to just let us know what you liked and what you learned and what we could do better, that would be really helpful. And please visit our website, patientsforpatientsafety.ca, to find the recording of this webinar later. Thank you again for coming, and thank you again to all of our speakers. Have a good day.